Okay, Assalamualaikum. Selamat petang. Right. So for today's topic, we are going to discuss a bit about restoring range of motion and also a way for you to improve one flexibility. Okay, as an introduction, when we talk about improving flexibility and range of motion, so in this topic, we are going to discuss a bit about the term flexibility itself and also range of motion. We are going to discuss about anatomy factor which will limit one's flexibility. We are going to discuss a bit about an assessment regarding active and also passive range of motion. We are going to talk about the stretching to improve mobility and all the other factor that maybe play a role or a major role in determining one flexibility and also range of motion. Okay, as an introduction, right? So when an athlete met with any kind of injury, it will always associated with loss of the ability to move normally. Okay, if we take an example, if we go play a futsal or soccer and we've been tackled by our opponent, all right? So the main area we talk about here is from the knee down, especially at the ankle. So if the tackle is straight to the point, most of the time you are going to get a swollen ankle, and this swollen ankle will ensure you are going to have some ability loss, especially towards movement itself. So this loss of motion or loss of movement, it may be a result of a very painful situation, or maybe it is due to swelling which limit the ROM, okay, a muscle spasm, or any inactivity resulting in shortening of connective tissue and muscle, or losing of neuromuscular control, or combination of all of these factors. Okay, and when you met with all of this, restoring a normal range of motion following one injury is a major or a primary goal in any rehabilitation program, because when we had normal range of motion, it will ensure us to be able to conduct our life as before. Okay, and due to this, athletic trainer must routinely include intervention designed to restore normal range of motion in order to enhance normal function again after any incident. Okay, all right. So to begin with, flexibility can be defined as one ability to move a joint or a series of joints through a full, non-restricted, painless range of motion. Okay, it can be active, it can be passive. So if you talk about active flexibility, more towards your own effort to move it around the range of motion. But when we talk about passive flexibility, it is more towards an assisted movement. Means a helper is needed in order to move the hand, the leg, or the parts through the range of motion. Okay, so flexibility is a measure. Okay, flexibility is a measurement of range of motion. So if a people, or if some of you can go through a lot more ROM, we are going to say that you are more flexible and vice versa. Okay, and flexibility is also dependent on the combination of a certain factor, such as the first one, joint range of motion, which may be limited by the shape of the articulating surface and by capsular or ligamentous structure surrounding the joint. For example, if we talk about synarthrosis joint, amphiarthrosis joint, and diarthrosis joint, these three type of joint depicting a different level of movement, such as when we talk about synarthrosis, it is immovable joint. It is a joint but unmovable. In other words, it can move with a certain a limited or limit range of motion compared to amphiarthrosis, which can move further along the range of motion, And the last one, the diarthrosis, which is a freely movable joint, which can move, as the name say, freely. Okay, and if we compare within the diarthrosis joint itself, we have several other type of joints such as hinges, ball and socket, condyloid, ellipsoid, and all those type of joint, they determine a different level of movement. Okay, we can see that ellipsoid, condyloid, ball and socket, that one permit the most amount of movement comparing with hinges. Okay, right. Next one, maintaining a full non-restricted range of motion has long been recognized as an essential part to a normal daily living. Try to imagine you unable to bend your knee. So you have a very limited range of motion towards your knee, and now try to imagine you try to do things with a very unflexible knee. So the movement itself is going to be restricted. Okay, in most patients, functional activity require relatively normal amount of flexibility. In other words, we don't need an extra amount. We just need our flexibility. We just need the patient flexibility to return back to normal in order for them to conduct their normal daily routine. Okay, however, some sporting activity such as gymnastic, ballet, diving, karate, and especially dance require an increased flexibility for a far superior performance. In other words, if you met with this kind of athletes during a flexibility rehabilitation program, you need to work extra in order to get them to those extra flexibility, or else their performance is going to be hindered. Okay, this is as the definition of it. Okay, now we go to the anatomy factor which may limit flexibility. The first one is muscles and their tendons. We know that in this muscle and tendon, we have a system known as proprioceptive, which consists of muscle spindle, Golgi tendon organ, and also joint receptor, which determine our joint movement. So we need to train muscles and also tendon in order to get a certain amount of flexible, or else they are going to be quite tough. They are going to be quite what we call it, it's going to be stiff. Okay, when this happen, we're going to lose some level of flexibility. Okay, secondly is connective tissue surrounding the joint, such as the ligament and also the joint capsule, because this one determine, or this one depicting the connection between bone and bone, such as our ACL, MCL, PCL, LCL, all those happen to be at the knee. If we have quite a good flexibility towards the knee, we need to have this flexibility, because one of it is by having a good flexibility we can do a lot of range of motion. Secondly, when we have a good flexibility, when all those part is not stiff, means it is quite flexible, we can actually reduce the tendency to get injured because of those flexibility properties. Okay, next one is slack ligament and joint capsule, loss of joint. Okay, this is also a limiting factor of flexibility. Bony structure, the bone structure of us, the fat composition of us. Okay, we know that fat people, okay, or endomorph people, comparing to ectomorph people, ecto can move further down the range of motion compared to endo, simply because they get stuck. Okay, and then we have a skin type, a skin flexibility. Okay, because um, when we talk about flexibility towards a muscle, the skin itself play a major role as a secondary part of flexibility. Okay, and then we have skin contractures caused by scarring of ligament, joint capsule, and also muscle tendinous unit. And finally, neural tissue tightness result from any acute compression, chronic repetitive micro trauma, muscle imbalance, joint dysfunction, and also poor posture. So by having all those meaning, our muscle is not going to be equivalent in terms of strength. Our muscle is not going to be equivalent in terms of length between parts of our body. So we are going to get some sort of tilting, especially towards our hip and also towards our shoulder. Okay, this is the anatomy factor which limit flexibility. Okay, and then we need to know what it means by an active range of motion and also passive range of motion. Okay, so active range of motion, also known as dynamic flexibility, refer to the degree to which a joint can be moved by a muscle contraction, usually through the mid-range of movement. Dynamic flexibility is not necessarily a good indicator of the stiffness or looseness of a joint because it applies to the adaptability to move a joint efficiently with little resistance to motion, while passive range of motion, or sometimes called the static flexibility, refer to the degree to which a joint can be passively moved to the endpoint in the range of motion. No muscle contraction is involved to move a joint through a passive range. When a muscle actively contracts, it produces a joint movement through a specific range of motion. Okay, and it being put here, however, if passive pressure is applied to an extremity, it is capable of moving further in the range of motion. It is essential in sport activity that an extremity be capable of moving through an unrestricted range of motion. So passive range of motion is important for injury prevention. There are many situations in physical activity in which a muscle is forced to stretch beyond its normal active limits if the muscle does not have enough elasticity to compensate for this additional stretch. It is likely that the musculotendinous unit will be injured. Okay, when we talk about active range of motion and passive range of motion, example, if we move our hand like this, okay, we move it through range of motion, this is known as active range of motion because it involves the degree to which a joint can be moved by muscle contraction, so by the contraction of bicep. However, when we reach a certain area, it can't move anymore, and we use another hand to pull it further behind. So when we add on this one after the full range of motion, we have a bit of add on by your own hand or by others. That is passive range of motion, meaning it does not cause by muscle contraction on that part, but it is caused by others. That is passive. So active, we move it on the on our own. For example, we do contraction to the bicep. This is active range of motion. So from hand straight to hand curl. And yet, if we continue or we give a bit of force downwards to this hand, it can move further down. So that is a passive range of motion. Okay, so if we try to talk, if we try to see that a person have a good flexibility, basically they need to have a good active range of motion and also passive range of motion without any injury, because in daily life most of the time we tend to move beyond our capable active range of motion. So if you have a good range, active range of motion but a bad passive range of motion, basically when we apply those extra forces to the muscle, it will actually cause them to be injured due to the fact that their range of motion or their flexibility is not up to that particular point. Okay, right. To assess active and passive range of motion, the most easiest way for you to do it is by using goniometer. Okay, so we have a multiple type of goniometer. It can be a conventional goniometer. It can also be an ELGOT, electronic goniometer, which use sensors and software to determine flexibility of of joint. Okay, it is an essential to assess improvement in joint flexibility to modify injury rehabilitation program. Improvement in joint flexibility, when we detect some improvement towards our patient, we can actually enhance the flexibility program. Okay, a goniometer is a large protector with measurement in degree. By aligning those two parts of our joint, we can determine how far the joint able to move. Okay, to enhance reliability, standardization of measurement technique and methods of recording active and passive range of motion are critical to individual clinics. Okay, this is the easiest way to determine a range of motion by using goniometer. Okay, this is an example of goniometer. So the first one is an analog goniometer. This is an analog goniometer where we use some sort of 360 protector and two lib. Okay, and this one is known as a digital uh, goniometer. This too is still a goniometer. It is not yet an algon. So if we have an algon, we don't have reading here. We just have sensor that being attached. Let's say we try to determine the flexion of the hip here. So we are going to have one sensor attached to the thigh, one sensor attached to the waist in order to determine the range of motion between those two. Okay, and as for this one, this is also known as an inclinometer, a more precise measuring instrument with high reliability that has most often been used in research. So digital inclinometers are one of the instrument in order to determine range of motion. Okay, the basic one will be this one lah. This is known as an analog goniometer. Okay. So the goal for any effective stretching program, okay, when we talk now, I need to have in your mind when we talk about stretching, it has a direct relation with range of motion. Okay, so the goal of any effective stretching program should be to improve the range of motion at any given articulation or any given synovial joint by altering the extensibility of the neuromusculotendinous unit that provide movement at the joint. In other words, we try to increase the capability of our muscle, of our proprioception at any given joint or any injured joint in order to get it back to normal or even better. That is stretching program. Okay, so it is well documented that exercise that stretch this neuromusculotendinous unit and the fascia over time will increase the range of motion possible about a given joint. So we know that exercise will increase our range of motion. Vast majority of the theory relative to muscle lengthening resulting from stretching attribute the increases to mechanical changes. A more recent theory attribute muscle lengthening to an alteration of sensation that changes the patient perception of when stretching elicit pain, allowing the muscle to be stretched to a greater length. So before this is said that stretching or muscle lengthening a result from stretching that increase the mechanical changes, means it increase the length of the muscle. However, the latest point of view see that it's not like that, but stretching or the exercise itself enhance or alter the sensation. They alter the thing here, which prolong or which induce the sensation of pain later to the process, which resulting we able to move through a lot more or a greater more range of motion compared to before. Either way, when we talk about movement or when we talk about stretching and improve mobility, means we try to get an effect towards our muscles, toward our membrane surrounding the muscles, toward our muscle spindles, towards our Golgi tendon organ, towards our joint receptor. Means we try to have an increment or we try to have changes towards our muscles and our proprioception system. Okay, that is the objective of stretching, right? Okay, neurophysiology basis of stretching. Every muscle in the body contain the various mechanoreceptor. So the most important mechanoreceptor, receptor towards movement, towards mechanics, is our proprioception, which include our spindle, our GTO, our joint receptor. Okay, so both type of receptor are sensitive to change in muscle length, while the GTO affected change in muscle tension. So in order for us to strengthen, or in order for us to lengthen, and also to return back to normal. So when a muscle is stretched, both the spindle and the GTO, where the spindle is located within our muscle, or we call it as an intrafusal capsule, and the GTO located in our tendon, okay, immediately begin sending a volley of sensory impulse to the spinal. Initially, this impulse coming from the spindle inform the CNS that our muscle is being stretched. So it is a limiting factor. Okay, it limit the stretch, our spindle. Okay, impulse return to the muscle from the spinal cord cause the muscle to reflexively contract, thus resisting the stretch. In other words, the spindle determine how far we able to go. The Golgi tendon organ determine how far the tendon able to stretch as the secondary contraction. So the primary is caused by our contractile component, the muscle itself, and it being limited by the spindle, while the secondary is being initiated by our tendon, okay, where the GTO works as the switch, right? And combining these two, active and passive, we have a total tension. We have a total output from a muscle group. Okay, next one. GTO respond to the change in length and then increases in tension by firing of sensory impulse of their own to the spinal cord. If the stretch of the muscle continue for an extended period, at least 6 seconds and above, impulses from the GTO begin to override muscle spindle impulse. Mean after 6 seconds, most of the time we are going to start our secondary tension. Okay, the impulse from the GTO, unlike the signal from the spindle, cause a relaxation of the antagonist muscle, thus make our muscle to retract. Okay, this relaxation serve as a protective mechanism which allow our muscle to stretch through relaxation without exceeding the extensibility limit, which could damage the muscle fiber. In other words, combining both spindle and GTO, it will determine how far a muscle able to contract without start to tearing up. Okay, so this is the limiting factor. Okay, the importance. Why it is important for us to increase our muscle temperature before embark in a very serious stretching program? Okay, so the most effectively stretch a muscle during a program of rehabilitation, intramuscular temperature should be increased. Increasing of this temperature has a positive effect towards ability of the collagen and elastic component within the musculotendinous unit to deform. So these two, most of the time, it it is these two comprise into our muscle membrane. So we have three different membrane layer. We have the uh, endomysium, epimysium, perimysium. Those three layer is a very elastic component towards our muscle. So um, by having our muscle to contract as the whole, those component will also be contract. If the component is stiff, so our muscle that stay within that unable to contract further. Okay, it unable to contract further comparing to the size of the membrane itself. So we need to make the membrane soft first in order to get a greater range of motion. Okay. Also, by increasing our muscle temperature, the capability of the GTO to reflexively relax the muscle through autogenic inhibition is enhanced. Okay, and it is clear that the best effect happen to be at 39 degrees, and this increase the intramuscular temperature can be achieved either through low intensity warm-up type of exercise or through the use of various therapeutic modalities. It is recommended that exercise be used as the primary means for increasing intramuscular temperature. So in layman words, we need to precede stretching with warm up. So go for warm up first have a bit of muscular, intramuscular temperature increasement, and then we go for a greater stretching to have a greater effect of range of motion itself. Okay, start with warm up and then go to stretching. Right, next one. Okay, stretching technique, we have different, but comparing all of this technique, it is much beneficial to get stretching by using PNF technique. Okay, proprioceptive neurovascular facilitation, alternating contraction and stretches. For example, if we stretch our bicep and tricep like this, when we pull our tricep back, okay, when we pull our tricep to the back at the same moment, this hand need to resist that. In other words, it need to push it out. So we have our left hand to push in, we have the right hand itself to actively resist. In other words, we have two force that acting upon one another. That is PNF. So some of the exercise can be conducted alone, and most of the exercise you need a partner to do a PNF stretching. Okay, other than that, we have ballistic stretching, repetitive bouncing motion. When you see ballistic, it involves power, it involves a burst of force being expelled out. So this is the most controversial type of exercise because it causes more damage compared to benefit if the body is not accustomed enough. Okay, the most common type of stretching is static stretching, stretching to a muscle to the point of discomfort and then holding it at a point of extended time, and continue with a dynamic stretching. Use controlled functional movement. For example, if you playing soccer, maybe you can have lunges during walking. Okay, walk a step and lunge, and then change the step and lunge. So that is a dynamic stretching where where it will involve movement from point to point. Okay, and then this is some guideline and precaution for a sound stretching program. Means for a good for a good stretching program. The first one, like I said earlier, warm up first. Okay, we'll start with warm up. We increase um, the intra the intrafusal temperature of our muscle first. Okay, warm up using a slow jog, a fast walk. Warm up with all modalities that require moderate to low intensity before we go with a vigorous stretching exercise. And then number two, to increase flexibility, the muscle must be stretched within pain tolerance and tissue healing limitation to attain functional or normal range of motion. If you just put the hand like this, okay, and then you stretch without even feel a bit of pain or any, it means that the stretching is not up to the point. The stretching does not give any effect because the muscle does not being stretched to a point of tolerance. Okay. Okay, we continue. Stretch only to the point where tightness or resistance to stretch or perhaps some discomfort is felt, and stretching should not be painful. If we try to talk in terms of biomechanics of stretching, when we stretch our muscle, there will be two types of tension happen towards the muscle group itself. The first is known as active tension, which is produced by the muscle that being stretched, and secondly is passive tension that being produced by the tendon and also by all those membrane. If we exceed these two, the effect of stretching or the tension that will be provided will actually reduce instead of increasing. Okay, increase in range of motion will be specific to whatever muscle or joint is being stretched. So in your program, please ensure you focus on the injured part to be stretched and also the other than that injured part. Don't just focus on the injured part itself, because at the end of the day, the injured part will increase in terms of performance, but other than that injured part, it will be decreases. Okay, exercise caution when stretching muscles that surround painful joint. Okay, pain is an indication that something is wrong and should not be ignored. In other words, if you try to stretch a joint, somehow the joint end up feeling unrealistically pain, or the pain is not normal. So stop your stretching. Please recheck the joint first before embark in another stretching exercise. Okay, avoid overstretching the ligament and capsule surrounding the injured joint. Okay, we don't know the extent of the joint. So we need to avoid, we are not going to say avoid them at all, but we try to avoid them. We try to overstretch them. Okay. Exercise caution when stretching the low back and also the neck. Exercise that compress the vertebra and their disc can cause damage. They can cause herniated of the disc. Okay, stretching from a seated rather than a standing position takes stress off the low back and decreases the chances of back injury. So if your patient is a lower back pain, modify their stretching rather than having them to stand up. You can have them to be seated. Be sure to continue normal breathing. Do not hold your breath or do not force breathing. Do not use the Valsalva. Okay. Static and PNF technique are most often recommended for individuals who want to improve their range of motion, and dynamic stretching should be done only by those who are already flexible or accustomed to stretching. In other words, dynamic stretching will be focused on towards the advanced stages and also towards the return to sport stages rather than the initial stage and also the intermediate stage. So for initial and intermediate, we are going to focus more towards static and also PNF. Okay, this is some of the examples that we can do in order to do some rehabilitation exercise to shoulder. Okay, we have early stages. We have wall climbing by using our fingers. So we go up in order to stretch our shoulders slowly. Okay, we have active assisted stretching. Okay, we have um, clinician assisted. This one is more towards passive movement lah. Okay, the first two is more towards active, and this one is more towards passive, where we perform the stretching with the aid of somebody else. Alternatively to stretching techniques, we can also change or convert them to be Pilates. This is another example of stretching. Pilates method of stretching. Pilates is an exercise devised by German-born Joseph Pilates, established the first Pilates studio in the US before the World War II. So Pilates method is a conditioning program which improve muscle control, flexibility, coordination, strength, and also toning. So the basic principle of Pilates exercise are to make patient more aware of their body as a single integrated unit rather than separated all those muscle. And each exercise is designed to stretch and strengthen the muscle involved. This method concentrate on body alignment, lengthening all the muscle of the body into a balanced whole and building endurance and also strength without putting undue stress to the lung and the heart. Okay, this is an example of Pilates. So most of the time when we involve in Pilates, it will involve in flexibility, balance, strength, and also cardio. So it goods, especially towards the intermediate um, level of the rehabilitation program. Okay, number two, we can also um, convert stretching to be yoga. So this one is more on breathing exercise. Okay, another example of yoga. It's quite similar as Pilates except for the movement. Okay, and also we have other manual therapy technique to further enhance mobility. Okay, mobilization technique should be used whenever there are tight articular structure. So following soft tissue loss, some of its ability to tolerate the demands of functional loading. If we have an open wound or whatsoever, so at the end of the day, we are going to get scarring and everything. So those further limit the range of motion. So a major part of the management of soft tissue dysfunction lies in promoting soft tissue adaptation to restore the tissue ability to cope with functional loading. Okay, this is some of the manual therapy technique that can be used in injury rehabilitation. We have myofascial release stretching. We have strain counter strain technique, positional release therapy, active release technique, Graston technique, massages, postural restoration. So it depends on the cases. That's not always it. We need to use all, but if necessary, this is some of it. And most common one is actually a massage lah. massage in order to further enhance flexibility. But if we compare the flexibility training itself with massage, so massage do give some effect, but it is not surpass the effect of the flexibility training. But if we can have both, and then it's going to be much better in terms of enhancing in order to shorten up the process of gaining flexibility through rehabilitation process. Okay, so this is myofascial release technique by using a stress roller foam, or maybe the most common one we are going to use tennis ball. Okay, any other flexible, any other type of modalities which can give a deep release or a deep trigger point release towards our patient. It helps. Okay, this one is about strain counter strain technique. Okay, the body part is placed in a position of comfort for 90 seconds and then slowly move back to a natural position. Okay, so strain counter strain technique is not those crack and everything. Okay, this holding to a part of strain and then release it back. Holding to a part of strain. Okay, we are going to put our strain just like stretching, and then we're going to hold it for a while and then put it in normal condition. So we are going to stretch the muscle and then re-stretch it back. We are going to stretch the muscle, but this technique is more towards assistive. Assistive means we need somebody else to do it to you, for you. Okay, somebody else to do it for you rather than you do it on your own. If you do on your own, it is known as stretching. Okay, we have positional release therapy, more towards what we call it a trigger point, acupuncture. So all of those helps in increasing the flexibility or the range of motion by using a baseline of if the muscles is not stiff, if the muscle is not spasm, if the muscle is not swelling. So you're going to have a good range of motion comparing with if the muscle is shortening, if the muscle is scarring, if the muscle is stiffing, or if the muscle is what we call it the muscle is short. Okay, so we need to release that first, and this procedure um, is an assisted procedure that be conducted by a specialist rather than focusing only with stretching. Okay, so we have active release technique. Okay, compare positional relief and active release. So active release require you to move for some part of the movement. For example, when we put pressure to the calf, so you're going to move your leg back or down and up in order to facilitate the muscle movement. Okay, Graston technique, in the other hand, they are going to use a variety of curved instrument to mimic a massage procedure, and they are going to apply pressure. Okay, they are going to apply pressure to the surface of the muscle. Okay, in the process to enhance the blood flow, and also at the same moment to break down all scar tissue and fascial restriction that may be present underneath our skin. So we are going to have a better length of muscle, a better supply of blood towards the movement muscle. Okay, massage is quite normal. Okay, and as for the conclusion, flexibility as a whole is the ability of your neuromuscular system to allow an efficient movement smoothly through a full range of motion. So if you can move but not through a full range of motion, means you don't have the flexibility yet. And as to be a good athlete, flexibility is one of the major factor which determining or which differentiating a winning or losing. So it need to be it need to be included in any rehabilitation process, starting from the initial stage up until return to sport. Okay, so flexibility is specific to a given joint, and the term good flexibility implies that there are no joint abnormality restricting movement throughout our body. So flexibility can be limited by muscles, it can be limited by tendon, it can be limited by the membrane, it can be limited by the capsule, it can be limited by the ligament, the fat, the bone structure, the skin tightness, and also the neural tissue itself. Okay, an agonist muscle is one that contract to produce joint motion, where the antagonist muscle is stretched with contraction of the agonist. In other words, we need to stretch both our agonist and antagonist in order to get a full effect of ROM towards our movement muscle or towards our body part. Okay, critical thinking. For example, the first one, we have a case of a gymnast is out of practice for 2 weeks because of a stress fracture in her tibia. And the question is, why is it essential to incorporate flexibility into the rehabilitation program, especially for this injury? So the injury is just towards the bone. Okay, we have a stress fracture towards tibia, means in order to enhance the process of repair towards the bone itself, we are going to limit movement of the leg. And since this is a gymnast, okay, so he is out of practice for 2 weeks, 14 days. So after 14 days, so after the cast being opened up, we need to enhance the process of flexibility of the ankle, flexibility of the knee, flexibility of the thigh, flexibility of the leg, or else this gymnast will be unable to perform their normal routine over, because those muscle will start, those surrounding muscle, the gastroc, the soleus, the hamstring, the quads is not properly stretched for 2 weeks. In other words, based on Wolff law, it will get short. Okay, it will get short, it will get stiff. So we are going to get some tilting towards the hip at the end of the day, and this will ensure not a good routine execution. So they need to go for a rehabilitation process from the earliest stage of the casting up until to return to sport again, in order to make sure the muscle return back to the normal length, return back to the normal constricting factor, and return back to the previous performance. Means it can be extended, it can be lengthened, and it can be shortened at a moment of time required by the athlete itself. Okay, next one. Okay, crucial to a gymnast performance. Although she is not training, she must maintain movement at all of her joints so that she does not lose flexibility. Inactivity can cause a shortening of elastic component, shortening of the muscle that I said. This will put her at risk for muscular injury when she tries to resume her normal gymnast routine. So we need to avoid that. Means it is essential for her to undergo, means it is essential for her to undergo a rehabilitation flexibility program. Critical thinking number 2. 2 days after an intense weightlifting workout, a football player is complaining of a quad pain. The athletic trainer determined that the athlete has DOMS. Okay, the soreness is preventing the athlete from getting a sufficient stretch. What can be done to optimize his stretching? So we know that the cause here is delay onset muscle soreness, lactic acid accumulation at muscles. Okay, the soreness cause, or the soreness prevent the athlete from getting a sufficient stretch. Okay, why they cannot stretch beyond the range of motion? Simply because of the pain sensation. So here, the most effective way is actually to undergo a lactic training or a lactic threshold training. Okay, so based on here, applying a certain therapeutic modality, such as we do for eyes treatment, okay, we do rice treatment, or we do an electrotherapy, or even we can actually propose massage to do to that particular uh, group of muscle in order to facilitate lactic acid dispersion, in order to speed up those process of exclusion of those lactic acid from the body. So the faster this process be done, the faster the effect of DOMS will be reduced. Okay, they can use ice, they can use electrotherapy, they can even use heat. So it can decrease pain and discourage muscle guarding the increased range of motion. So DOMS most of the time begin to subside after 2 days. Okay, however, with a proper stretching, okay, cooling down process, especially by using PNF, we can further reduce the effect of DOM at the earliest stage. So they are going to feel as much pain as without those kind of exercise. So it is recommended to do PNF stretching after a workout, okay, in order to further enhance the capability of the muscle to tolerate lactate, and also in order to exclude those from the system as fast as you can. Okay. Number three, following an ACL surgery, one of the first goal of rehabilitation is to regain full range of motion. How can improvement in knee extension be quantified for day-to-day record keeping? Okay, this fella undergo an ACL reconstruction. So after an ACL reconstruction, there will be some um, some limitation, especially towards knee extension. So if we use knee extension, we are going to see an increment from day to day, angle to angle. Means as before, the angle increment is going to be less and it will be increased day by day. So it helps in day to day record keeping. Okay. So goniometer can be used to measure the angle. Okay. So like I said earlier, we take another example. We take our shoulder. Okay, we take our shoulder. We take our elbow. Okay, if you see here, let's say we go for the flexor surgery. Okay, in other words, if the flexor before the surgery we unable to do bending. Okay, now let's imagine that your knee. So day by day, after the rehabilitation process, we can track the effect of surgery by knowing the angle of bending. So maybe for the first day we can bend a bit. Second day it goes further, third day it goes, and if the fourth day it can go straight for the full ROM. So when we see this improvement, this is actually a sign that the procedure is effective and it is a sign that there are improvement. Okay. Now here see that a goniometer can be used to measure the angle between the femur and the tibula, giving that the degrees of flexion and extension to maximize consistency. It is helpful if the same person takes sequential goniometric measurement. Today we measure, tomorrow we measure. We try we try to see whether we can actually extend. Okay, we try to see whether we can actually extend our knee. Uh, for sure after the process the extension is going to be less and it will be increasing throughout the day, which showing a good sign of ACL surgery come back. Okay, next one if we have it. Okay, that will be the end of today's topic. Okay, so basically this topic talks about why we need to do exercise, or why we need to focus on flexibility towards our body, and what kind of exercise that we can do in order to enhance the flexibility of our body. And again, flexibility exercise may start from initial stages up until return to sport. It depends on the intensity of the exercise, and always proceed stretching with what we call it with warm up exercise. Warm up first, increase all those muscles temperature, and then followed by stretching exercise. It helps a lot in further enhancing our stretching itself. Okay, so that's all for today, and we're going to meet again next week in class. Thank you, and assalamualaikum to all.